The following program is sponsored by ILRU, Southwest ADA Center, promoting compliance with the Americans with Disabilities Act.
Welcome to Focus on Abilities, a program about issues affecting the lives of people with disabilities. I'm Lex Frieden, your host. I'm a professor at UT Health Houston, and I direct the Independent Living Research Utilization Program at TIER Memorial Hermann. We're so glad you tuned in with us today because we have an amazing guest and an interview we're about to conduct. But before we do that, I have a question that you can think about. You can Google it. You can find the answer before the end of the show. When was the American Association of People with Disabilities founded? We'll get back to that later. Right now, we're going to take a short break. We'll be right back. Stay tuned for Focus on Abilities. I'm Lex Frieden. You're watching Focus on Abilities on HTV. Our guest today is the illustrious Maria Town. She's the Executive Director and President
and CEO.
American Association of People with Disabilities. Formerly aide to the mayor, and Houston, you all probably know her. And I'm glad you're on the program today, Maria.
I'm really glad to be here, Lex.
I want to talk a little bit about what the objectives of AAPD are. Mm-hmm. Today is, 2024. Mm-hmm. AAPD was founded when?
July 26th, 1995. So next year we will be 30 years old.
Wow.
Yeah.
So the AAPD was based on a need to have representation for people with disabilities in the United States. And Maria, have you achieved that objective?
No. We've made a lot of progress. So the American Association of People with Disabilities, we're a national cross-disability civil rights organization. And we are working to increase the political and economic power of the more than 70 million people with disabilities across the United States. Even though we are a huge community of people, you know this, Lex, we are denied equal opportunity at every point in American public life.
So tell me, 70 million,
Mm-hmm.
It's a big number.
Huge number.
If you look at the Census Bureau data,
Yep.
You got 51 million.
Mm-hmm.
Where do you get the other 20 million?
70 million comes from the Centers for Disease Control's most recent survey, and the 70 million is inclusive of newer disabilities like long COVID, which we are still understanding.
What about baby boomers?
Mm-hmm. Yeah, so disability is a natural part of the human condition. I always like to say that if you're lucky enough to live a long life, you're going to be lucky enough to become disabled. Aging is a privilege. So we have lots and lots of people who are all turning 65 and older every day. And as people age, they're going to become disabled. Their amount of sight will change, their hearing will change, their ability to move around. So disability and aging go hand in hand. And you see, as you look at kind of the ages of the American population, if you look at people who are 65, 70, 75, you get huge proportions of folks with disabilities.
Is there, in your estimation, a kind of a critical balance between the knowledge of disability in that population and the knowledge of disability in what we would prior say was the disabled population? So, you got these 20 million people.
Mm-hmm.
They don't know about disability.
That's right. I see. Yeah, I think there's a lot of wisdom that people like you and me can share with folks who are newly disabled, whether they're newly disabled from something like long COVID or they have recently been diagnosed with multiple sclerosis. One of the things that I went through recently, my father had to have a liver transplant, and he became very disabled as his liver failed. And I had to help him learn how to stand up when he had lost a lot of abdominal strength. I've had to teach him a whole lot about how Medicaid works and about how Medicare works. And this is all knowledge that I've gained as a person with a disability who's been disabled my whole life, not just from my own personal experiences, but from being a part of disability community conversations. And I think that this is a really important point, Lex. A lot of people who become disabled later in life don't realize that there's a whole community of folks like you and me who are out there ready to kind of welcome them into the fold and say, we're in this together. And that's really the point of AAPD.
So one question, aging people all seem to know about AARP.
Mm-hmm.
They get a card, they pay their membership, they get a discount at Denny's, and so on. What's AAPD do to represent those people in terms of things that they need that are not advocacy oriented?
So, as you mentioned, AAPD does a lot of advocacy work to change policies, hopefully for the better, or prevent bad policies from kind of getting onto the books. We did a lot of work to save 504 from being overturned by the Supreme Court recently. We also, a key way that anyone, whether they're disabled or not, gets their voice heard is through voting. So we have a major voting initiative called Rev Up, which actually started here in Texas. And we have more than 20 Rev Up coalitions across the United States. And this year alone, we have distributed more than $500,000 to all of these grassroots disability voting coalitions to get disabled people registered to vote and make elections more accessible. Lex, one of the passions of Paul Hearn, AAPD's founder, was to really build the leadership of the disability rights movement. And so we have a lot of programming that works towards that goal. We have multiple internship programs that bring students and recent graduates with disabilities to Washington, D.C. to intern with congressional offices or federal agencies. We provide housing, people are paid. And as we've discussed, because disability is such a diverse category of experience, some of our interns are 18, some of them are 56. Yeah. And it's a really exciting moment to see this group of people come together. So we aren't like AARP. We can't get you a discount at Denny's. We don't have our own insurance that we sell, but we do try to do a lot of other things that improve the lives of disabled people.
I don't want to spend a lot of time with this, but have you considered providing those kinds of tangible benefits to people?
We could. I think it would get tricky because one of the things that those kinds of benefits rely on is disclosure, right? You have to prove that you're over 65. And for a lot of people with disabilities, they don't have formal documentation of their disability if they have anything at all. And I'm still trying to get a accessible parking placard from the DC Department of Motor Vehicles because they had my wrong address. And so, beyond my mobility device, I would have no proof of me being disabled. So there are a lot of issues around that don't happen with age, if that makes any kind of sense.
Yeah. So I want to talk about how aging people are affected by disability and how AAPD can help them be empowered. But up first, we're going to take a break.
Okay.
So you all please stay tuned. We're here with Maria Town. We'll be right back with more Focus on Abilities.
You could eat
every night of the week in Houston and only scratch the surface of all the different types of cuisines that we have here. There's so much to explore. The best way to take it is just neighborhood at a time. Each neighborhood has its own specialty, and there's just so much to learn. It's one of the best things about food is that you can never learn it all.
This is HTV. This is Focus on Abilities. This is Lex Frieden. Maria Town is here with me today. And Maria, we're talking about AAPD and people who are aging into disability. We find in interviews that many of those people really don't know how to represent themselves. Mm-hmm. Does AAPD have any kind of programs that will help promote advocacy among elders?
We do, and we work a lot with organizations that focus on older adults, organizations like Justice and Aging, AARP, as well as the Diverse Elders Coalition. Together, we try to collectively elevate the voices of aging, disabled people. And a part of it, too, is actually just getting people to understand at a very basic level that disability is not a bad word and is not inherently a bad thing. Now, I can say as a disabled person that it is not always easy or fun to be disabled. I mean, there are times when my body will not do what I want or need it to do, and it is painful, literally. So I can understand why people would resist kind of claiming this identity. But I think one of the most important things that AAPD does is represent the idea that no matter what happens, no matter how much technology changes or medicine improves, disabled people will always continue to exist. And so we have a variety of programs where people can really understand what disability is, what disability leadership looks like, and why it's important to actually say, I'm a person with a disability, I can be proud of that, and here are the things that I really need to thrive.
Yeah, I think that's really important. There are a lot of people, friends of mine, mm-hmm. who really get frustrated, and life is hard, and sometimes their solution is just to stop life.
Yep.
They can live, they can be active in the community, or they can move into a nursing home, or they can, quite frankly, die.
Yep.
Some people choose the latter because they don't have any footsteps leading toward the former.
That's right.
Are you doing empowerment training for the population?
Not right now. It's one of the things I would love to start. So Lex, we should talk about that. The HTV viewers, I would love to hear from them around what they think would be effective. I think there's a lot to just figure out, what kind of training is really going to reach someone who is aging into disability, who is not ready to even Google an organization like AAPD because they're not ready to say I'm disabled. We got to start from a slightly different place.
Yeah, let me jump over a little bit.
Yeah.
I know that you personally are an advocate for technology.
Yep.
Have you guys been in touch with the AI folks?
Absolutely.
To talk about how AI can remove prejudice, or how in the AI brain there's not a negative tag on disability.
Well, that's not exactly true. That is how AI is pitched all of the time. And one of the things that we're trying to do at AAPD is not allow technologists to kind of use disability as this fancy unicorn thing to get kind of bad technology out into the market because they promised this unbiased technology. What we actually see is, for example, in hiring and recruitment platforms that are fueled by AI, there's a significant bias against candidates with disabilities.
That's really important. What are you doing about that?
We have filed a complaint with the Federal Trade Commission on, what is that word? Where companies will claim there's no bias, and then we test the products and they weed out all of the disabled candidates.
Wow.
We've also worked with the Equal Employment Opportunity Commission to get guidance around the use of AI in employment, noting that if these tools actually are biased and are not accessible, they're violating the ADA, the Americans
Well,
with
there's two
Disabilities Act.
issues. One of them is the artificial brain is biased.
Yes.
The other one is the technology to interact with the brain.
It's not accessible.
It's not accessible.
Correct. And we are still, as much as technology is advancing, we are still pushing for basic accessibility to the internet, both with connectivity, because disabled people, particularly disabled older adults, face significant digital divides where they don't have connectivity to an internet connection, and they also don't have a device to actually use that connection. So we're currently pushing for the Federal Communications Commission to help disabled people, whether they're young folks or older adults, pay for devices to actually use their internet connection. And we're working with different states because, you may not know this, the federal government invested a ton of money to get people connected to the internet.
Right.
And we want to make sure that they're including people with disabilities or people who have disabilities, right? Whether they're someone who actually says, I'm disabled and I'm proud, or someone who shows up and is clearly disabled even if they don't use that.
Well, I recall a program where people with disabilities might be eligible to get assistance getting online, or at least getting connectivity to the internet, to the international internet.
The Affordable Connectivity Program,
Yeah.
Congress chose not to fund it again. So it's all out of funding. It ended in April.
Well, what were you doing then?
We were trying to get Congress to fund it.
Maria, you worked for one president,
Yes.
President Obama.
That's right.
You worked for a mayor in Houston, Sylvester Turner, and then you were drafted by the disability movement to become head of the AAPD. In those various roles, have you seen any opportunity for breakthrough?
Yes, in every role. With President Obama, he was really interested in engaging the community in new ways and getting the disability community voice on issues that we hadn't typically worked on. And one big one that I remember is on the issue of gun violence prevention. Gun violence is the third leading cause of spinal cord injuries in the United States. Gun violence creates disability, and when I was working for President Obama, most disability organizations were not even talking about this. I was able to work with the disability community to identify gun violence survivors who had become disabled, who were both advocates for gun violence prevention, some of them were gun owners themselves, and who were also disability advocates. One of them, Jennifer Longden, wound up, after meeting Barack Obama, wound up running for the Arizona State House, and she
Wow.
won.
Fantastic.
Yeah. With Mayor Turner, when I was the director of the Mayor's Office for People with Disabilities, he understood disability in ways that I had never seen an elected official understand it. He understood the difference between diversity and inclusion. I'm sure, he's been on this show saying diversity is descriptive, inclusion is active. And one of the things that we did together was work to elevate the status of the Mayor's Office for People with Disabilities, and now the office has more staffing, more resources than it did when I initially started.
Yeah.
And
well, you know, I should interject that if people are watching and they need help with disability-related aspects of the city of Houston, they should get in touch with the director there, Angel Ponce. And do you offhand know the number?
I don't, but one of the things that I learned this week is that the Mayor's Office for People with Disabilities has a great collaboration with 311 now, where they're really integrated into the 311 system.
Yeah. I mean, I can tell you that I was concerned about somebody in my neighborhood who built a new home and they put a sidewalk in without any ramps across the street to the Metro bus stop. And through a report by somebody to 311, the inspectors went out, busted the old curb, and made them redo the sidewalk. And now it's a beautiful example of accessibility. So I think people need to take initiative, not just feel sorry because somebody did it wrong, but take initiative and call the mayor's office on disability. Furthermore, on sidewalk issues, which a lot of people have issues for, the mayor's office has access to some money that will help people build sidewalks if they're needing to get to the Metro stop, the drugstore, to school, or wherever.
It's called the Pedestrian Accessibility Review Program, or the PAR program. And you can put in a PAR request with the Mayor's Office for People with Disabilities, and that request gets prioritized by the Public Works Department. The other way that citizens can have their needs known is to go to the Houston Commission on Disabilities meetings. Those meetings are the second Thursday of every month from 4 to 6 at TransStar on Katy Road.
Yeah. Angel's been our guest here on a couple of occasions. He's very articulate. Don't forget 311. If you forget any other numbers, that's fine. Call 311 if you have an issue.
People should also go to aapd.com and check out our resources.
Okay. Maria, we're going to take a break.
Great.
Then we're going to come back and talk more about what AAPD can do for you, for people in the community. And we'll be right back.
Ready to spice up your day? Downtown Houston has exactly what you're craving. Swap your weekday dinner for award-winning takeout. Treat yourself to bold, unique flavors or fresh from the oven classics. Drink outside the box, from breweries to cocktail bars. There's always something new to taste when you join us downtown. Visit downtownhouston.org to find restaurants and bars for your next delicious adventure.
Make the right call. 211-311-911. My home is on fire. Call 911 for emergency assistance such as ambulance, police, or fire. The fire hydrant is gushing everywhere. Call 311 for city-related services like water leaks, traffic tickets, and more. I need help finding a new place to live. Call 211 for all social service needs such as food banks, housing, shelter assistance, healthcare, and childcare services. Make the right call. 211-311-911.
Throughout the COVID-19 pandemic, Metro has been there for you, getting medical center employees and other essential workers to their jobs during lockdown. We're also improving your customer experience, from more frequent cleanings to security monitors on vehicles. We've launched free Wi-Fi and installed over 3,000 new accessible bus stops, all to make your ride better. Visit ridemetro.org to learn how you can drive less and do more.
Houston 311, now available as a mobile app. Take a photo, enter your location, report an issue. The quick and easy way to report non-emergency issues or request city service information. Download today on the App Store or Google Play.
Sam Houston Park is picturesque with waddling ducks and 9 frozen-in-time historic buildings.
Hey, thank you all for joining us on Focus on Abilities. Maria Town is our guest. Maria, you've done a lot of work in advocacy. What do you believe are the major challenges now for people with disabilities in Houston, in Texas, in any of the states and in the United States?
I think that one of the most pressing challenges involves what we in the disability community call community integration, which is about anyone's ability to live in their community, in their home, with their friends and families that they love. Our policies have what we call an institutional bias, meaning that it's a lot easier for our healthcare system to pay for someone to be in a nursing home or a group home than to pay for them to get the supports they need to stay in their own home and go to work, eat what they want to eat, etc., etc. Related to that, we also have a workforce shortage of direct support workers, and that is in part because a lot of these jobs, even though they are absolutely vital, aren't good jobs.
Well, I'm not even sure everybody understands that issue.
Yeah.
If you have a disability, if you're older and you need help in your home, it's really hard to get help.
Yes.
And people are expected to arrange for that themselves.
That's right.
There's no agency that does that for you. Some local aging agencies may provide home care to a limited extent and may provide Meals on Wheels, but that's about it.
That's it.
And to find somebody who will help you, there is no program that you can call up and say, hey, I need some help. The state pays $90,000 a year for somebody like me in a nursing home, and yet there's no way that they will provide assistance to me in my home unless I qualify for one little known Medicaid managed care company, and that is managed care program, and that not very many people have the opportunity to use that.
That's right. I mentioned my dad previously. When my dad was very sick, everyone in my family assumed that he would be able to get home health care because he got Medicare. And I had to explain to people, Medicare doesn't cover this. Everyone assumes that there is this safety net for older adults, and there should be, right? Because folks have worked their whole lives. People deserve these benefits. They deserve to stay at home. So what had to happen, Lex? I had to go home and take care of my dad and live in Louisiana. And this is something I just have to say that your example really helped me through, because I want to shout out Mac. You always told me that you and Mac keep each other out of the institution, and that's what I was able to do with my dad. But, a lot of people assume that disabled folks like us aren't caregivers as well, and we are. And a lot of the people doing the work to keep folks in the community have disabilities themselves and also need care.
So, Maria, we're winding up the show. What's the number for AAPD? How do people get in touch? Is there a website?
There is a website. It's aapd.com. .com is really important. You can find us on Facebook, Instagram, Twitter, and I don't even know our phone number, Lex. But you can also email us at communications@aapd.com. We'd love to hear from you.
Okay. Maria, thanks for being our guest today.
Thank you for having me.
And thank all of you for watching Focus on Ability. I've learned a lot on this show today. I hope you have too. At the beginning of the program, we asked, when was the AAPD founded? It was surprising to me, a long time ago, 30 years ago, 1995. There you go. So anybody that's interested in AAPD, you can get in touch. Please do. Maria will be there with a great staff of people who are helping advocates all over America. Please tune in next time for Focus on Abilities. I'm Lex Frieden, and we're really looking forward to seeing you later. Thank you.
following program is sponsored by ILRU, Southwest ADA Center, promoting compliance with the Americans with Disabilities Act.